So I was going to talk about the triangle of disease, but I had all these other questions here. So I don't know, is that what I have to talk about, the triangle of disease? Are people expecting that? Have you guys heard of the triangle of disease? Have you heard me talk about that? Have you, Melissa? No. Okay. So we'll talk about the triangle of disease for sure. And then at lunch today, I said that there was one thing that people have to have if they're going to actually leverage the power of nutrition and really leverage the power of the body to heal itself. We know that every time you cut yourself, your skin heals, right? I mean, we take that for granted. You don't have to think about it. You don't have to plan it out. You don't have to do any work. Your skin heals, right? Well, that same healing mechanism that kicks in when you cut yourself takes place in the entire body. The body is meant to heal itself. It's designed to heal itself. And it has millions of years of evolution behind it that are set up so that cuts heal. When you have a degenerative disease, and most of the illnesses that we suffer from in this country are said to be chronic degenerative diseases. Sometimes medical people will say non-communicable diseases. Communicable diseases are things that are infectious, that transmit. Most of our illnesses are in the way of chronic degenerative diseases. In other words, the body degenerates. I always tell this little joke, so you can if you've heard it before, laugh, even if you haven't. Thank you. Here's the joke. You know, there's 30,000 different diseases. Literally, the World Health Organization has a list of all the diseases. 30,000 different ways the body can break down. That's impossible. How can the body break down 30,000 different ways? It's not true. There's 30,000 names for different diagnoses, but in reality, there's only one disease, chronic degenerative disease. I call it MBFA disease. My body is falling apart disease. Okay, and that's the only disease there is. Your body falls apart. It degenerates. But the cool thing about degeneration is the body can regenerate, and we see this every time we cut ourselves. So there's really no reason for a disease to tumble out of control unless you're doing what we all know is the definition of insanity, which is what? Doing the same thing over and over again and expecting different results. So the body has a built-in ability to regenerate. So you say, why is it that people are sick? Why is it that people aren't leveraging the body's built-in power to regenerate? And we were talking at lunch, I said, there's one thing. There's only one thing you need to be able to access that power. You know what that is? Willingness. We said it was mindset earlier. It's a type of mindset. You have to be willing. And when you run into people who aren't interested, right? And we all have people in our lives like that. And you say, why? Look what this can do for you. You take the Beyond Tangy Tangerine, you feel better. You take the Healthy Star Pack, you lower your blood pressure. You start using nutritional supplementation, the longevity nutritional supplements, and your health challenges start to disappear. You say, why aren't you doing this? Because you're missing the one thing, and that is willingness. But once you have willingness, it's in the body's repertoire to be able to heal itself. It does it on its own. Now, it needs raw materials. It needs to have the raw materials in order to fuel the regenerative process, and that's why we're here today, is to talk about the raw materials, but you have to be willing to participate. And if you are willing, I can guarantee you that when you start to use these strategies and these protocols that we talk about, and it's both strategies and protocols, strategies and products that we talk about, and it is strategies and products together. It's not just products. You have to have a certain strategy. There is no way that you cannot reverse whatever your chronic degenerative disease is. There's no way. It is built into the system to do it. And it's not just diabetes and it's not just autoimmune diseases, it's the biggies. It's cancer, it's heart disease, it's autoimmune problems, it's Parkinson's disease and neurological issues, everything. And you can see this yourself if you want to witness it. Find somebody who's really sick. Find somebody who's really sick and wants to participate. And the beautiful thing about the human body is the sicker we are, the faster we turn it around. How cool is that? The more nutritionally deficient you are, the faster your body absorbs nutrients. That's kind of like a little secret, almost like a trick that the longevity business and business distributors have, is people who are really, really sick or really, really nutritionally deficient really notice results. Have you seen this yourself in your life? Those are the people who notice the results because the body is built such that a dry sponge sucks up more water than a wet sponge. When you're really, really nutritionally deficient, your body will suck up those nutrients like a dry sponge sucks up water. People who need to lose 100 pounds, the first 90 pounds come right off. It's the last 10 pounds that are the hardest. And that's really the beautiful thing about this nutritional supplement business is, for one thing, you're helping people who really, really need it. For another, they'll notice it right away. Have you guys experienced this? Where people who are really, really sick notice it right away. I always tell people, nursing homes. If you ever seen anybody in a nursing home or older folks in nursing homes, those people are so nutritionally deficient, it's almost like they're being abused by the kind of foods that they're eating, the kind of care that they're getting. And it's not a knock on the people who are doing the care, who are giving the care, the nurses and the CNAs and the LPNs and the doctors. It's really a knock on the model that says that we're just going to keep you on drugs and we're going to keep you medicalized until your demise. Go to a nursing home with a bottle of Beyond Tangy Tangerine, a jug of Beyond Tangy Tangerine. Watch what happens. Start giving it out to people if you can get away with it. It's so amazing. It's like a plant that you water that hasn't been watered. Have you ever watered a plant that hasn't been watered for a week and you can almost see it starting to sprout up in front of your eyes? That's what happens when you give somebody who's in a nursing home Beyond Tangy Tangerine. Something as simple as that. Why wouldn't we do it unless we're not willing? That's the only thing. So once you have willingness, these are tools that you can use, and we'll talk about some of these here today, that you can use to begin the reversal process of anything in the way of chronic degenerative diseases, anything. And it's tragic to me that unfortunately people aren't willing, but if you are willing to do it, and you're willing to participate, blood pressure can drop, weight can be lost, people can be off their medications, and most importantly, thinking can be clear. Most importantly, however, is you have more energy, more joie de vivre, and that's really what it's all about. Our medical model doesn't know about joie de vivre. We have a medical model that is about death, not about life. Why? What do I mean by that? Our medical model is designed to save us from dying, which is a good thing, right? If you get trauma, if you get hit by a car, if you have some kind of trauma, if you have a horrible disease, a heart attack, it's a good thing we have a medical model that saves us from dying. But because it doesn't recognize life, it's only there to prevent death, it thinks it's okay to take your organs out. It thinks it's okay to take you off all your nutritional supplements because they'll interfere with your drugs. Have you heard this before? It's okay. It thinks it's okay to tell you or to advise you or to recommend or even mandate that you don't eat broccoli because it might interfere with your blood thinner. This is really what happens in the medical model because they focus on saving us from dying, not on giving us joie de vivre in life. Nutrition, on the other hand, doesn't only save you from dying, it gives you vitality. It gives you energy. It gives you resilience. It gives you resistance to disease, and it truly accelerates healing. There's no drugs on planet Earth that can accelerate healing. That's not their job. It's our job. It's the people who are selling nutritional supplements. It's the people who are promoting nutritional strategies and exercise strategies and so-called alternative ideas of healing, which I hate, by the way, the idea that what we're talking about is the alternative. It should be the other way around, right? This should be the primary. The other way should be the alternative. So the number one thing you have to have is willingness. Once you have willingness, Longevity has got products that can help you leverage what's built into your body. It's not the supplements that are doing it, you're doing it. Your body is doing it, but the nutrition is fueling the process. All right, so what I noticed from doing talks and from talking to a lot of people, I'm a pharmacist. You guys all know who I am. I don't need to introduce myself, I imagine. What I noticed when I was seeing people and talking to people who had various health challenges, there were always 3 points of breakdown underneath their arthritis, underneath their Alzheimer's or their dementias or their neurological problems, underneath their cancer, underneath their heart disease. So that most of the illnesses that we suffered from were secondary in the sense that they followed these 3 basic points. And the more I studied it, the more I saw that these 3 basic points of breakdown were developmental. They happened sequentially. They started off really young. I'll tell you in a moment how young. And then they developed over time to the point where they reached a tip of a triangle in essence. And from that tip, every other disease ensued. All other diseases were above a foundation of 3 points of breakdown that I started to call the triangle of disease. And the cool thing about the triangle of disease and the bad thing about the triangle of disease is, bad thing is, if you don't approach the triangle of disease when you're dealing with heart disease or Parkinson's disease or Alzheimer's disease or cancer or any other health challenge, you're not going to be successful. There's no way to address the subsequent illnesses without addressing the foundation triangle. That's the bad news. The good news is, once you address the triangle, all the other diseases that are on top of the triangle will begin to resolve themselves. And the extra good thing about the triangle of disease is you don't need a medical professional to do it, to help you with it. You can do it yourself. They're all based in lifestyle. And so these 3 points of bodily breakdown are critical to understand. Number one, if we're going to be able to resolve health challenges on top of the triangle of disease. And they're critical to understand because you can't deal with anything on top of the triangle until you deal with the foundation, the triangle. Okay? So what is this triangle of disease? Well, it starts off, the triangle of disease. How many of you guys have heard this, by the way? Okay, you've all heard this. Hopefully. What's that? Is it just 3 of you? Okay, good. All right. That's really important. The 3 points, the 3 points on the triangle of disease start off way early. In fact, for most people, it starts off in utero, in the womb, as we're developing. But for the vast, vast majority of people, certainly in this room, because we didn't really understand this basic point of bodily breakdown until recently, is the digestive system. When a baby is born, comes out the womb, and it's bathed with a coating of bacteria. And that bacteria, from that point forward, become that baby's health angels for the rest of that baby's life. Those bacteria are personal to the baby. We all have our own personal bacteria via this bath, this immersion that the infant or the fetus and then the infant undergo when they come out vaginally, right? These bacteria go into the baby's nose, they go into the baby's digestive system, and they implant in the baby's intestine. And these bacteria make vitamins for the baby. These bacteria help the baby digest its food. These bacteria communicate with the intestine to make sure that the intestine is secreting the right kinds of chemicals for food digestion. These bacteria communicate to the liver and to the gallbladder to make sure bile is secreted appropriately. These bacteria are the baby's health angels. And they're personal. They're so personal, they're like a fingerprint. Everybody's got their own bacterial population. In fact, in the future, when there's a crime, detectives in the future will look at the bacteria to find the perpetrator. The bacteria will announce who did the crime because the bacteria are personal to every individual. They're like DNA. They're personal to all of us. However, as important as these bacteria are, and by the way, there's bacteria, the bacteria collectively, you all probably heard this term, are called the microbiome, right? And these bacteria of the microbiome don't just live in the intestine. They live everywhere in the body. They live on your skin. They live in your lungs. They live in your urinary tract. They live in your eyes. Literally on your eyes, you have bacteria. In the follicles of your eyelids, you have these bacteria. These bacteria, in a way, are who we are. We're like a carrying case for these bacteria. We're like vehicles for the bacteria. There's 10 times more of them than there are of us in terms of our cells. There's 10 times more bacterial cells than there are your cells. However, as important as these bacteria are, they require a healthy mother. If the mother is not healthy when she delivers her baby, that baby is not going to have the right kind of bacteria. If the mother has a cesarean section or has the baby by cesarean section, today we have 30% of babies are born cesarean section, more among us in this room because we didn't really know about any of this stuff. By the way, all of this stuff we know about the microbiome, these bacteria, has only been learned really hardcore over the last 20, 25 years. It was 25 years ago, a mere 25 years ago, the turn of the 20th century, the 1990s, we didn't have any clue, at least a very small inkling about what the importance of these microbiome bacteria. So 30% of babies are born cesarean. Right off the bat, you've got 1 out of 3 chance. Hi there. You've got a 1 out of 3 chance of not having the right bacteria to make vitamins, to communicate with your intestine, to depoison or detoxify the body, to talk to your brain. By the way, these bacteria talk to the brain and will tell you what foods to eat. And so we make food choices sometimes based on what these bacteria are telling us. So right off the bat, you've got a problem with the digestive system and the body's ability to process food. Now, once the bacteria implant, there's a system in place that nature has set up to allow those bacteria to proliferate. That system is called breast milk. And breast milk is loaded with nutrients that are specifically designed to allow those bacteria to thrive. Well, we know that many women don't breastfeed. If you ever see a physician or a medical professional suggest that you don't need to breastfeed, that you need Ensure, or that you could use, not Ensure, but you use formula, right? You know you have a medical professional who doesn't understand how the body's supposed to work. And this happens all the time. How many of you had children or grandchildren where the doctor said, don't worry about breastfeeding, all you need is formula? This happens all the time. So 30% of babies are born cesarean. Right off the bat, you got 1 out of 3 babies who are going to have a problem. Now you compound that problem with a mom who is either not breastfeeding at all, or not breastfeeding long enough, or even if she is breastfeeding and breastfeeding long enough, she may not be nutritionally competent herself. So her breast milk may not have what it needs. So now you've got a baby, he's just born, or he's a month old, or he's 2 months old, and he's crying all the time. He has a condition they call colic, right? You've heard of colic? It comes from the word colon. A colic problem is a colon problem. And this is a baby who is not getting nourished, who's not getting the benefits of the foods that he's eating, if he's eating quality foods, but chances are he's not even eating quality foods. So now your baby is maybe a month, 2 months, 3 months. He's complaining all the time. He may have acne on the face, literally babies with breakouts on the face from allergic reactions. They may have baby eczema. They may have asthma. And this is an extremely common condition. And you know right away if you have a baby who's got some kind of health challenge that something is wrong with the nourishment, because that's all the baby needs is nourishment. Once the baby is nourished, he has everything he needs, because human babies are born like we are all born to heal, to regenerate, to grow. So if there's a problem, there's going to be a problem with the nourishment. So you got the baby now. He's a month, 2 months, 3 months, a year. He's got breakouts. He's got asthma. He's got eczema. He's just colicky. He's just cranky. He's not processing energy as well as he should, because the digestive system is where we process energy from. When the baby does not process energy, when he's not able to obtain energy from his food effectively, he goes into a low blood sugar state. Can't get energy from the food, so he's low blood sugar. When a baby is low blood sugar, he gets really cranky, starts crying, right? Any moms can relate to this? What do you give your baby when your baby cries and he's cranky? Apple juice, of course, apple juice, or pear juice, or maybe baby food, right? That's filled with some kind of sugar, and the baby's happy for a little bit because now his blood sugar goes up. But blood sugar is a little tricky. Sugar's a little tricky. In fact, sugar is very explosive stuff. And do you ever get a sugar burn? When you're baking pastries or you're baking something with a lot of sugar and a little drop of sugar, melted sugar gets on your skin, it burns hot. Sugar is extremely hot stuff. There are places in the Midwest, in Iowa, where they have these large buildings and they say, do not smoke cigarettes near this building, right? They're called grain silos. Because in grain silos, you've got all these loose particles of flour floating around. Loose particles of flour, basically sugar, and they're very explosive. Sugar is explosive stuff. So the body has evolved a system for pulling that sugar out of the blood, because once the sugar gets into the blood, it can create all kinds of havoc, and it does create havoc. In fact, one of the things that happens to diabetics is their body starts to burn from the inside out. And you can actually go, if you're diabetic, you can actually go to the doctor and he can tell you how fast your body is burning. They do a test. They call it a hemoglobin A1C test. Anybody hear of that test? That's a test to see how fast your body is burning up because of sugar. Diabetics don't handle sugar as effectively. So now your baby is about a year old, 2 years old, 3 years old. He's constantly cranky. He's got digestive health issues. He's either gassy or constipated. You're using glycerin suppositories. He may have asthma. He may have immune problems. He may be breaking out. He's cranky all the time, and you're giving him apple juice, and it works for a couple of minutes or 10, 15, 20 minutes, and then he's cranky again. You give him more apple juice, and this situation, this blood biochemical situation continues on until the baby is maybe 10, 11 years old. At this point, I call it the high blood sugar, low blood sugar roller coaster starts to tumble into a biochemical situation called juvenile diabetes or pre-diabetes, sometimes they say. And today we have an epidemic of children who have this pre-diabetes condition. Now, we know about it today, but it still existed while we were young. We just didn't know what it was. Although now it's a very severe problem. So you got your baby, he's born, his digestive system is starting to become compromised at birth, and shortly thereafter, he's got immune problems because the immune system is located in the digestive system, largely. And he's not handling sugar correctly, so he's constantly cranky, he's constantly moody. You're always giving him sugar to get him some more energy, and then that only works for a few minutes. You give him more sugar, so we got this high blood sugar, low blood sugar roller coaster. Now he's about 11 or 12 years old. He's starting to gain a little weight. He doesn't feel like exercising as much. He may have concentration problems. He may have learning issues, all secondary to this high blood sugar, low blood sugar roller coaster. Now the baby's about 12, 13, 14 years old. He's overweight. He's addicted to donuts and he's addicted to sugary foods because he's trying to keep his blood sugar from dropping too precipitously. He's got digestive health issues. He's now 13 or 14 or 15 years old. All of a sudden, he starts to notice problems with sleeping. He may have really oily skin and acne. He may get cold sores. He may have problems with his immune system. This is all following the body's compensatory mechanisms for dealing with this high blood sugar, low blood sugar roller coaster. High blood sugar is a dangerous situation for the body. Low blood sugar is a dangerous situation for the body. So the body's stress system starts to kick in. The body's stress system is housed in the adrenal glands. Adrenal means on top of the kidney. It's got these two glands that are called your adrenal glands, and they help you deal with stress, and they secrete a hormone called, who knows? Cortisol. Exactly. And so cortisol helps you get out of a jam. It's a very important hormone, but it's only supposed to come out once in a while. But because of this high blood sugar, low blood sugar roller coaster, and because of the digestive distress, the lack of energy, cortisol is constantly being secreted. Now the baby's 15, 16, 17 years old, and he can't sleep, or he's got anxiety issues, or he's got weight problems, or he's depressed. Is this sounding familiar to anybody? This is a very common syndrome that happens. Now the baby is now 17, 18 years old. His cortisol is constantly being secreted. His stress hormone is constantly being secreted. So he has coffee energy, jittery energy. The body has a mechanism for dealing with this chronic cortisol condition, this chronic coffee energy condition. And the way the body deals with this is by suppressing the main energy gland in the body. There's a gland in the body that controls all of the behavior of all of the cells of the body. It gives the cells energy, to put it simplistically. And this is your thyroid gland. The thyroid gland controls everything. So you got your baby. He's born cesarean. He's not being breastfed, or if he's breastfed, he's not breastfed long enough. He's constantly getting sugar. He's starting to get weight problems. He can't sleep. Got anxiety issues. He's jittery. In response to all of this, the thyroid starts to slow down. That's a condition called hypothyroidism. At this point, once the thyroid slows down, every cell in the body becomes compromised. Muscle cells don't muscle as effectively. Heart cells don't heart as effectively. Liver cells don't liver as effectively. Every single cell in the body performs at a suboptimal level. This hypothyroid condition is the jumping off point to every single chronic degenerative disease. You don't need your thyroid checked. If you have a degenerative disease, by definition, that is a disease that's not getting better, that's getting worse. You can rest assured you're hypothyroid. You don't need to have it checked. You can just assume you're hypothyroid. You can rest assured that you're hyperadrenal. That is, your adrenal glands, your stress glands are cranking out a lot of cortisol. You don't need to have any tested. You can rest assured you got blood sugar problems. You don't need to be tested for your blood sugar problems. If you have a chronic degenerative disease, literally by definition, you are dysglycemic. That means messed up blood sugar. And if you're dysglycemic and you have a chronic health challenges, degenerative health challenges, you can guarantee that you've got a digestive health issue too. That's the triangle of disease. It underlies every health issue you can name in the way of chronic degenerative diseases. So number one, that sounds really bad. But the good news is, if you work on these 3 points, if you work on digestive health, if you work on your blood sugar health, and you work on the health of the adrenal glands, and I'll tell you exactly how you do it, your heart disease will automatically improve. Your autoimmune symptoms will automatically get better. Your cognitive and neurological issues will automatically improve. The symptoms will automatically improve. You just have to focus on these 3 points. The problem is we have a medical model that doesn't do that. We have a medical model that works at the level of the disease. And that's why it doesn't work, because you can't take care of your Parkinson's disease unless you take care of the triangle. You can't take care of your Alzheimer's unless you take care of the triangle. You can't take care of your autoimmune problems unless you take care of the triangle. But if you take care of the triangle, everything else will improve.
So Ben, I'm just going to stop you there for a question.
Yes. Yes.
What are the 3 points again?
The digestive system, the blood sugar system, what I call the adrenal thyroid complex. Because the adrenal glands and the thyroid glands relate to each other. They talk to each other. So what you got to do is you got to work on digestive health. You got to stabilize the blood sugar, and then you got to calm the body down, period. And it's very easy to do. Anybody here dealing with a chronic illness or know somebody who's dealing with a chronic illness? Okay, good.
And then if you don't mind jumping into what do you call it?
We'll start off with the digestive system.
Pro, and
Yeah. So the first thing you do is the digestive system. I always, whenever for you guys doing the business, this is really the first thing you want to do if you're dealing with somebody who has a health challenge, focus on digestive health. Not because I'm a foodie, not because I'm David Avocado Wolf, I'm not, that's not what I'm talking about here. It's not a question of you're a bad person or a good person. And that's kind of how we look at food, and people feel guilty about the way they eat and they don't want to hear about it. And has nothing to do with that. It just has to do with this is the core. This is the soil that gives rise to the tree. And it's no accident, by the way, that the major and most important component of quality soil is quality bacteria. Ask any farmer. You have to have nitrogen fixing bacteria at the bottom of the soil to be able to make the plants grow. Likewise, our bacteria and our intestine are nitrogen fixing bacteria and soil. They're not nitrogen fixing bacteria, but it's the same kind of relationship. The body is a tree that arises from the bacteria in the intestine the way your plants arise from a soil and bacteria. So the first thing is to focus on digestive health. And in fact, if you want to feel better right away, if you have an autoimmune problem, if you have fibromyalgia, if you have a neurological health issue, whatever it is, where you're symptomatic, stop eating. It will not take very long for you to notice that you're feeling better when you fast, for a couple of reasons. First of all, when you fast, you stop the input of the enemy into the system, and you give the digestive system a break. But number two, when the body doesn't have any calories put into it, it kicks into a secondary emergency energy generation system called ketogenesis, which gives you great energy and helps your mood and supports your immune system and does everything wonderful for your body. All the great things in life kick in when we go into this ketogenesis phenomenon. You guys have all heard of the ketogenic diet. Well, the ketogenic diet, you don't need to have the ketogenic diet to enjoy the benefits of ketogenesis. All you gotta do is stop eating. Now you gotta stop eating for long enough to do it, but once you do that, and if you guys have fasted, you can relate to this, you don't feel like eating. Have you ever fasted to the point where you just don't feel like eating because you feel really good because your body has kicked into this ketogenesis phenomena? So the first thing you always want to do is focus on digestive health, and that starts off with a fast. Now, people have a hard time fasting. So if you can't fast, you can't fast. At least restrict your calories, lower your calories. Calories represent work. And if the body is already under duress, the question then becomes, do you want to expend your precious energy resources digesting your food? Or do you want to spend your scant resources feeling better, healing, recovering, growing? And that's really what the choice is. Because if you're spending your resources on food, digesting your food, they're not available to build muscle. They're not available to make more blood vessels in your brain. They're not available for you to feel better. And the choice then becomes, do I want to digest my food or do I want to feel good? And this is what a choice that people have to make if they're dealing with a chronic degenerative disease. You can't get better from your chronic degenerative disease unless you approach the triangle, and especially unless you approach the first point of the triangle.
Okay, real quick, let's say they do that, they go into fast.
That's the first.
Yes, client is ill, and then do they need any sort of
Well,
supplementation, like protein building blocks.
So let's get into that. So the first thing I always tell people is to fast, although there is resistance to that. So at least restrict your calories because calories represent work. What does the word calorie really mean?
Energy.
No, calor, Spanish. What does calor mean? Heat. Exactly. A calorie is a unit of heat. And just like you have a little fan in your hard drive, and just like you have a fan in your engine, high performance machinery doesn't want to run hot. And there's no more high performance machinery than the human body, right? The human body is an incredibly high performing system. It doesn't want to run hot either. And this is why every study that's ever been done on longevity shows that the less calories you ingest, the longer you live, because your body runs cooler. So just that alone, that step alone will have people feeling better. People don't want to fast, at least calorie restriction. Now, Melissa has a very good point. What do you do about supplementation? Well, there's two kinds of supplements. You have supplements that are based in macronutrition, and you have supplements that are based in micronutrition. Micronutrition has no calories. Macronutrition has calories. Protein, fats, and carbohydrates are your macronutrients, and those are caloric. Your micronutrients, your vitamins and minerals, are non-caloric, and they help the body use your calories. So you can always use micronutrients. When you're fasting, you don't need the macronutrients because your objective when you're fasting is to give the body a break and to kick in ketogenesis. And to the degree that you're using your macronutrients, you're going to affect ketogenesis. So a fast is no macronutrients, and you don't have to worry about micronutrients. You guys get that distinction, vitamins and minerals. So you can still do your Beyond Tangy Tangerine. What?
Still have recovery.
What do you mean?
The patient's really ill.
Like recovery?
No, like they're really ill.
Yes.
And they're weak.
Yes.
That's where they still going to have recovery with micro.
Yes, they'll still have recovery from micro. Yes, 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 absolutely. So fasting is a little bit difficult, at least restrict calories. And then you have your patient or your client do a food diary. A food diary will provide people with the most amazing information because most of the time we do not make a connection between what we eat and how we feel. Most of the time we have disassociated our foods from our symptoms, but when you do a food diary, you write down everything you eat, it's clear. Every time I have tacos, I break out. Every time I have corn, I feel gassy. Every time I have milk, my autoimmune symptoms get worse. You'll start to notice things. A food diary is where you write down everything you eat, and then next to it, you write down your symptoms, whether they're digestive symptoms or whether they're inflammatory symptoms, whether they're cognitive symptoms, whatever they're, skin symptoms. Skin is usually a really good indicator because skin symptoms, and I've been in the skin business for many years, skin symptoms will show up quickly. Digestive systems will show up a little bit later, and inflammatory systems also will show up quickly. So have your patient or your client watch the relationship between the two, and this does several things. Number one, it gives the client a sense of responsibility, a sense of control, a sense of my fibromyalgia isn't just happening to me, it's happening to me in response to something I'm doing. And this is very empowering for somebody. And not only is it empowering, but it shows the customer and the client that you know what you're talking about. Because all of a sudden they realize every time I have corn, my fibromyalgia gets worse. And they had no idea. That piece of information alone not only is life-changing, but it presents you in your healing practice or in your business practice as an expert. So number one, what happens is they start to see the connection between their lifestyle choices and their illnesses, and that's very empowering. And number two, it starts to present you or portray you as an expert, as somebody who knows what they're doing, somebody who has seen a connection that their doctor has not seen, that nobody has seen. And that puts you in a very powerful position as somebody who's going to be a helper, a healer, a coach, whatever it is that you're positioning yourself as. And then number three, and this is possibly the most important benefit to this whole idea of working with the digestive system with your customer, is it allows you to see if they're really wanting to make a difference in their life. Not everybody is. So when you see resistance, you know you have a customer who's not necessarily on board. And you know what? That's a very important piece of information because guess what? People get to be sick. You know, this is not about saving the world. This is about saving those who want to be saved. And if somebody is not participating in their own health process, if there's somebody who's saying, you fix me, that's a client that you don't necessarily want to have. So it weeds people out who aren't on board with the whole process because it's going to be a process. So number one, you're going to your client's going to see the connection between their lifestyle choices and their illnesses. Number two, you're going to have an ability to, you're going to get presented as an expert. And number three, you're going to have an ability to weed people out, to see who's really on board with making a difference in their life. So always, always, always focus on digestive health first, always. You will be a hero. And because it's the first point on the triangle of disease, you can't help somebody successfully unless you focus on that first point. The second point is what I call dysglycemia. Dys means messed up. Glycemia means blood sugar. Dysglycemia is messed up blood sugar. You notice I did not say diabetes, because you see your blood sugar is way more messed up, or your blood sugar becomes messed up way before you get pronounced a diabetic. A diabetes is a diagnosis, right? Sometimes people will say, when I'm doing a talk or something, they'll say, oh, he's not a doctor. He can't tell you anything. George Norrie always says, he's not a doctor, you know, because you're not supposed to say anything if you're not a doctor. If you're not a doctor, you can't tell anybody. Baloney. That's made up. There's no law that says you can't say anything if you're not a doctor. What you can't do is you can't diagnose. That's not allowed. Only doctors get to diagnose. Fine, you don't need to diagnose because a diagnosis is irrelevant. Biochemistry is what's happening in your body. A diagnosis is a word. That's all a diagnosis is. And guess what? You can treat a biochemical dysfunction. You can't treat a word. So when you get diagnosed with something, that doesn't matter. What we want to focus on is the biochemical dysfunction. Diabetes is a word. Diabetes is a name. Diabetes is a diagnosis. Dysglycemia, messed up blood sugar, is biochemistry. That's a pathway. That can be worked on. You can't heal a word, but you can correct a biochemical dysfunction. Did you want to say something?
We got a question.
Yes. Is this making sense, by the way, you guys? Okay.
So the question here is, can diabetics fast?
Of course. Why not? They go into ketogenesis, which is a way better way of producing energy than sugar. Absolutely. Okay. Now you got to be a little bit careful, depending on how severe their diabetes is, because their insulin may be really, really high, but absolutely they can fast. And ketogenesis is great for diabetics. Ketogenesis is great for people who have neurological health issues. Ketogenesis is great for immune issues. And ketogenesis is great for cancer, even though the conventional wisdom says to keep the calories coming. If you have cancer, your job, the goal of ketogenesis, the ketogenic diet means it's generating ketones, is to have these little energy bombs produced in response to your body breaking down fat. So your body breaks down fat when you're not putting calories in. It has to have a source of energy. And this fat processing for energy generates these little magical, powerful nuclear bombs of energy called ketones. And yes, your goal as a diabetic, if you want to do this chemistry, is to get these ketones going. That's why, by the way, breakfast is the most important meal to skip, right? Because breakfast is when you're breaking a fast. So breakfast is you've generated ketones, or you're on the way towards generating ketones. For most people, they're not. But if you stop eating at, say, 4 or 5 o'clock, by the time the next day rolls around, your body's had 18 hours or so to start generating these ketones. And what do? We stop the whole process by eating breakfast, because we're all told we're supposed to eat a big breakfast, especially an energy-providing breakfast, which completely shuts down the ketogenic process. So ketogenesis is your goal if you're a diabetic. Now, depending on how severe your hypoglycemia is, if you're a diabetic, sometimes you go really, really low blood sugar, you may want to lay in bed for a little bit. You may not want to go out and do your day, and that you'll have to see how you do it. But theoretically, there's no problem with ketogenesis and fasting for a diabetic. So anyway, you notice I didn't say diabetes, I said dysglycemia, because we want to focus on the biochemistry. By the way, for you to get diagnosed as a diabetic, anybody diagnosed officially as a diabetic here? You have to have a blood sugar score of about 120. I'm not going to get into the details of that blood sugar score. Just remember the number 120, right? 120, if your blood sugar score is 120, that's how much sugar is in your blood. They say, boom, you're diabetic. You get diabetic drugs. You get insurance for diabetes. You get to wear a T-shirt that says I'm a diabetic and a little hat that says I'm a diabetic, whatever it is that you're officially diagnosed with. But if you're at 119.999999999, you're fine. That's the lunacy of this model. That's the lunacy of the functional medicine model that tests you. Now we have functional medicines, they test you for everything, right? So if you have a certain score, bingo, you get coded into the computer and now you're officially a diabetic. But the problem is your biochemistry becomes dysfunctional way before you're at 120. Your biochemistry is thrown off, your sugar processing biochemistry is thrown off way before you reach the criteria for being a diabetic. I'll get to you in just a second. Does that make sense? So what we want to do is we want to focus on dysglycemia, the body's ability to process sugar. Go ahead. I'm sorry, Sue.
Two types of diabetics, though.
Not really, but yes, I know what you're talking about. There's type 1 diabetes and type 2. Is that what you're referring
Yes.
to? So not really, but for our purposes, there's type 1 diabetes, which is diabetes related to an autoimmune disease of the pancreas that keeps you from making insulin. There's type 2 diabetes, which used to be called they used to call it type 2 diabetes or adult onset diabetes. Now they have to call it type 2 diabetes. Adult onset diabetes is a diabetes that occurs as your body is breaking down over time. As this whole triangle proceeds, type 2 diabetes kicks in, and usually people be type 2 diabetic. They used to be when they're in their 30s or 40s. Now it's happening way young. In fact, they don't even call it type 2 they don't even call it adult onset diabetes. They call it type 2 diabetes because kids get it. And that's a degenerative condition. But the biochemistry is pretty much the same in the sense that the body's not handling sugar correctly. In the case of in the case of an autoimmune disease of the pancreas, you're not making insulin. In the case of type 2 diabetes, your body is resistant to insulin. It's a little bit different. So they used to tell you that if you had type 1 diabetes, autoimmune diabetes, the pancreas, that you're on insulin for the rest of your life. There's nothing you can do about it. Today, we're finding that as it turns out, over time, the beta cells, those are the cells that make insulin, can actually be regenerated. And you can make more beta cells. And so we even today, and based on my philosophy, how the body regenerates itself, it makes perfect sense. It turns out that with type 1 diabetes and with the correct kinds of nutritional protocols and digestive dietary strategies, you can handle that as well. That's kind of what you're talking about. But what I'm referring to is just the body's inability to either listen to insulin or to make insulin. Okay? Either way, your blood sugar starts to go up. That's what diabetes is. Your blood sugar goes up. You don't handle sugar. What's supposed to happen, by the way, because sugar is so explosive, the body can use sugar for energy, but when it doesn't use it for energy, it stashes it away. That's what we call our fat butts. That's the stashed away energy. It turns out, interestingly, that foods, whole foods, unprocessed foods, have just the right amount of micronutrients to process the macronutrients. So when you eat a food that's whole and unprocessed, the protein, the fat, and the carbohydrate will get utilized by the body effectively by vitamins and minerals and essential fatty acids and essential amino acids. These are micronutrients. That's why you want to eat whole foods, because whole foods have just the right micronutrients to process the macronutrients. So you guys, this is making sense with the micro and the macro? You guys get this, right? So today we figured out how to just get the macronutrients without the micronutrients. And that's what a processed food is. A processed food is a food that has lots of the macronutrients, the calorie nutrients, the nutrients that create a burden on the body without the micronutrients. And this, by the way, is why when people start micronutrient supplementation with the Beyond Tangy Tangerine and the Healthy Start Pack, guess what happens? They don't need as much macronutrients. And they feel full because now their body can use the micronutrients to process the macronutrients. And this is one of the great advantages, we don't even talk about it really, of micronutrient supplementation is you lose weight. And you don't feel like eating as much. And you're satisfied, you're full faster. You're satisfied faster. So back to our story about dysglycemia. You want to correct dysglycemia. Fasting is a great way to correct dysglycemia because now, all of a sudden, your body can generate ketones for energy instead of being dependent on sugar. Another great way to, and by the way, let me say this real quick. The ketogenic diet, you guys have all heard of the ketogenic diet, right? What is the ketogenic diet? What are the rules of the ketogenic diet? Anybody know? What is it?
Well, you want your carbs low, you want moderate protein, and you want high healthy fat.
Okay, you want high healthy fat, you want moderate protein, and you want your carbs low. What's the most important part of the ketogenic diet that you didn't say? And I'm not trying to pick on you, but I'm saying this is why the ketogenic diet doesn't work for people. is because they miss the most important point. Well, you do need those, but that's not the most important point. You need water, it's true, but that's not the most important point. Well, that's what Debbie said. No, but you're on the right track. The most important part of the ketogenic diet is it is a low calorie diet.
Yes, 1200,
Very
lower than 1200.
exactly lower than 1200. And most people, when they hear the ketogenic diet, right? Most people, when they hear the ketogenic diet, think, oh yeah, bacon, potato chips, lots of meat, lots of, anything I eat is fatty, and lots of protein, hamburgers, and all the foods that we all love to eat. No, the ketogenic diet is a very, very low calorie diet. In fact, the ketogenic diet was actually developed when it was noticed that people who fasted didn't get seizures. And we've known that for a long time, that fasting is like a strategy for seizure disorders. In fact, in the Bible, it talks about fasting for seizure disorders. And so around the turn of the 20th century, they want to know, what is it about fasting that lowers seizures? This is so amazing, really, when you think about it. And so they looked in the chemistry of people, they looked in their blood to see what chemicals were secreted when they fasted, and they realized that there were certain chemicals that were secreted that could be enhanced by dietary strategies. This is how they developed the ketogenic diet. It was a diet that was supposed to mimic the biochemistry of fasting. Well, it turns out, and this will get to your question about pre and postbiotics, it turns out that when you fast, a chemical is secreted into your blood in response to this whole ketogenesis process. This chemical is so amazing. This chemical that's secreted in response to ketogenesis is a chemical that goes to your brain and makes you feel happy. It makes you feel satisfied in life. It makes you lose weight. It acts like an appetite suppressant. It acts like a libido aid. It acts like a relaxant and antidepressant. It's a cool chemical, right? This is a chemical that's secreted in response to fasting. And this chemical is also secreted, as it was discovered, in response to the ketogenic diet. And this is how the ketogenic diet became popularized in the 1920s, early 1900s. What is this chemical, right? Cool chemical. You want to know what this chemical is? You don't care? Nobody cares? Forget it. You gotta, come on. You want to know what this chemical is, right? This chemical is great for sleep. It's great for relaxing. It's muscle building. It builds your immune system. It's weight loss. Come on. You don't sound, you don't care. Forget it. All right, so let me tell you a little bit. I'm totally fascinated with this molecule. It's a weightlifter. Weightlifters love this molecule. In fact, you know what I'm talking about? This is a what is it? No.
Serotonin.
No.
Dopamine.
This is a molecule that's secreted in response to fasting. It's a molecule that's also secreted in response to the ketogenic diet, and it's the molecule that's responsible for keeping seizures down because it works on the brain. Hang tight. And you asked me earlier about prebiotics and postbiotics. One of the main ways we get this molecule.
And you win.
No.
You get it when you run.
What's that? You don't get it when you run necessarily, but you do get it when your bacteria are operating as they should, because this is a chemical that's made by bacteria in the gut. It's a chemical that you could buy in the health food store. And it's a chemical that used to be legal, but became illegal because people felt so good when they did this chemical. They had to make it illegal, right?
No, I think I know what it is.
This is a chemical that's rich, abundant. Its most abundant food source is what? Its most abundant food source is butter. It's a chemical called butyrate, butyric acid. And there used to be a chemical that I used to make it in my lab when it was legal, and then I had to stop making it, called GHB. You ever heard GHB? Gamma hydroxybutyrate. Butyrate. Do you remember when GHB was all the rage and people would do GHB? They get the best night's sleep. It was the most incredible libido enhancer. It was great for muscle building. And they made it illegal. And it's a chemical that's made in your brain. In fact, you can go to the health food store and get a derivative of it called gamma aminobutyric acid, or GABA. You heard of GABA? GABA is so powerful that it's actually a prescription drug, except they had to tweak the molecule a little bit. They call it gabapentin. Anybody heard gabapentin or Neurontin? They use it as for nerve pain, for fibromyalgia, because this molecule is so salubrious. It's so important for health. So drug companies, they couldn't sell this stuff because it's found in butter and it's an abundant molecule in nature and it's cheap. So they had to tweak the molecule and they sell it as Neurontin. There's GABA, which gabapentin, which is an anti-seizure medication, but also used to treat various health issues. So where are we going with this? Butyrate is made when you fast. Butyrate is made when you go ketogenic. Butyrate is made by bacteria in your gut as what's called a postbiotic. Butyrate is food for your colonocytes, your intestinal cells. People who have intestinal cancer and colon cancer are notoriously low in butyrate. So butyrate is a foundational, incredible molecule, and the best nutritional supplement you can use to help support butyrate synthesis is your ultimate EFAs. And by the way, what's that? How are we doing for time, by the way? Oh, really? Okay, so I'm going to wind this down real quick. So your ultimate EFAs, if you want to support your butyrate synthesis, get yourself on ultimate EFAs, keep your sugar down, use your sweeties. We're talking about dysglycemia. So fasting, ketogenesis, ultimate EFAs, these are all very important for getting the benefits of sugar control. And then don't forget your sweeties. In fact, to me, this was Dr. Wallach's brilliance. When I first heard, I didn't tell you my story when I first heard dead doctors don't lie, but we studied chromium and vanadium in pharmacy school, as chromium in particular, as a anti-diabetic medicine or anti-diabetic supplement, anti-diabetic nutrient. In fact, there's a molecule in the body that helps you handle sugar called the glucose tolerance factor. You may hear the GTF, the glucose tolerance factor. And and we studied this in pharmacy school. The glucose tolerance factor depends on chromium. And when I heard Dr. Wallach talking about chromium, I was all over it. I mean, he said a few things that really, as a pharmacist, I knew he was right on. But to me, that's one of the most important of all of Youngevity's products. But it's not just for sugar. The sweeties is not just for sugar. The active ingredient in sweeties also lowers your cholesterol. And by the way, elevated cholesterol is a classic sign of dysglycemia. And the reason why we have such a huge cholesterol problem and everybody's on statin drugs is not because the body is making too much cholesterol because it's crazy, because it's just dumb. And it's not because you're eating too much cholesterol, it's because our blood sugar is messed up. So when you start to control your blood sugar, your cholesterol drops like a stone. Anybody on a statin drug or know anybody on a statin drug, get them on the sweeties and start doing all of these anti-sugar strategies that we're talking about and watch what happens to your cholesterol. And it's a well-known fact that people who have elevated blood sugar also have elevated cholesterol. So get on the sweeties, incredibly valuable. Magnesium is also incredibly valuable, the osteomag for lowering blood sugar, and possibly the most important and underappreciated nutrient for lowering blood sugar is your ultimate niacin. The ultimate niacin is a blood sugar stabilizing nutrient. In fact, niacin is arguably the most important of all the vitamins. I say arguably because a case could be made for a lot of them, but certainly a case could be made for niacin simply because niacin is the one vitamin your body will make under deficiency conditions. The definition of a vitamin is something that's essential. Your body can't make it. Well, guess what? Niacin is so important that if you have niacin deficiency, your body will make a little bit of niacin. Niacin deficiency not only will mess up your blood sugar because that glucose tolerance factor depends on niacin, but it will also cause skin problems, sensitive skin. Anybody know somebody who has sensitive skin? Oh, I can't put anything on my skin. Everything makes me break out. Oh, I can't handle the sun. Classic sign of niacin deficiency. In fact, down south, after the Civil War, there was a big problem with niacin. Niacin is only found in high protein foods. This is why they developed peanuts, was to get people there was a lot of poverty down south after the Civil War. So there was a big protein shortage. And so that's how they developed peanuts. Well, it turns out that under conditions of protein deficiency, there's a relationship between high protein foods and niacin. People were also deficient in niacin, and they would have incredibly sensitive skin. The signs of niacin deficiency involve redness of the skin, especially in response to the sun. And this is where we get the term rednecks from. Rednecks were people who were suffering from a niacin deficiency disease called pellagra. So people have sensitive skin, people have sun sensitivities, ultimate niacin. Niacin deficiency will also cause cognitive problems, dementia, mental health issues. Niacin is used to treat social anxiety disorder, schizophrenia, and psychosis. Alzheimer's disease can be partially the result of niacin deficiency. So for cognitive problems, for anti-aging, way better than Prevagen. Get yourself on the ultimate niacin. Digestive health issues are common under conditions of the ultimate niacin deficiency. And in fact, if you go to medical school, they'll tell you that niacin deficiency disease is called pellagra, and it's marked by the 4 Ds: diarrhea, dermatitis, dementia, and death. Those are the 4 Ds of pellagra. Well, you don't have to have full-blown diarrhea. You can just have irritable bowel syndrome or ulcerative colitis. You don't have to have full-blown dermatitis. You may just have sensitive skin. You may just be sensitive to the sun. Or you may not have full-blown dementia. You may just have memory problems. You may just forget things. For all of these issues, including blood sugar, get yourself on the ultimate niacin. And the last nutrient that's really important for blood sugar that nobody knows about is your ultimate selenium. So for all diabetics, ketogenic diet, fasting, and not diabetics, all dysglycemics. You see the difference? I didn't say diabetes, dysglycemics, ketogenic diet, fasting, ultimate niacin, ultimate selenium, sweeties, more fiber, osteomag. Fiber is another very important nutrient for people who have dysglycemia. One of the best, cheapest, easiest nutrients for people who have messed up blood sugar. Anybody know anybody who has diabetes diagnosed or messed up blood sugar? They take their blood sugar every morning, they take their test. In the morning, your blood sugar is high because in the morning, your blood is concentrated. Blood sugar is blood sugar concentration. So the easiest way and the quickest way to lower your blood sugar concentration is to dilute your blood with water. So make sure you're drinking a lot of water. In fact, first thing in the morning, drink water. Yes, yes, it's thick with sugar. Yes, yes, all of that, exactly. And this is why diabetics have problems with their feet or they have problems with their extremities. You ever see diabetics' feet who have people who have diabetes and they have their feet or their toes amputated because they can't get blood down to that area. Or they'll have kidney problems. The kidneys have to filter blood in very tiny capillaries. So diabetics often have kidney problems. They'll have eye problems because the blood is not circulating as effectively, but you may not have full-blown eye problems or glaucoma or blindness or macular degeneration or full-blown neuropathies. Neuropathies are another problem where you have pain in your extremities. You may just feel sluggish. You may just feel tired all the time. You may just not be thinking clearly. All of these are manifestations of this thick blood. Then the third point on the triangle of disease is this adrenal thyroid complex. And there's lots of nutrients you could take, but the best way you can think of working with the adrenal glands is to relax the body, is to calm the body down. Anybody experience this where you're really tired, but you can't fall asleep? Anybody ever have that? Guaranteed you're dealing with a cortisol issue. Get yourself on nutrients that balance out cortisol. One of the most important is melatonin, Sleep Ease. How many of you use the Sleep Ease product? Get yourself on the Sleep Ease. Melatonin balances out cortisol. Melatonin is your relaxing nutrient or relaxing substance. It's actually a hormone. And melatonin not only calms the body down so you can go to sleep, not only antagonizes cortisol, but it's a powerful anti-aging nutrient whose levels naturally drop as we get older. So the Sleep Ease is not just for sleeping. It's for anti-aging and it's for balancing out cortisol. Other nutrients that help balance out cortisol include all of the nutrients in the Beyond Tangy Tangerine. In fact, the Beyond Tangy Tangerine is a relaxing supplement because it helps antagonize and block cortisol. Perhaps the best thing you could do that's non-nutritional for relaxing, for lowering cortisol is to work on the first 2 points of the triangle of disease, because remember, it's developmental. So by working on your blood sugar, working on your digestive system, you'll naturally quiet down the cortisol, the hypercortisol or hyperadrenal activity, which will then allow your thyroid to start to kick in, and all health challenges from that point will resolve themselves. I'm gonna just finish this real quick because I'll take questions here in a minute. That's the triangle of disease. The best way to leverage it or to access it, because remember, this is the body doing this, you're not doing this, is get people on a nutritional supplement program. Get them on the Healthy Start Pack. If they don't want the Healthy Start Pack, at least the Beyond Tangy Tangerine. And then let them discover the power of nutritional supplementation. If you want to go all out, start working with your blood sugar system, the ultimate niacin, the ultimate selenium, the ultimate magnesium, or the osteomag, and then the sweeties, of course. And then stabilize cortisol by relaxing the body. I didn't talk to you about deep breathing. That's really, really important. Muscle relaxation, progressive muscle relaxation is also very important. Meditation is one of the greatest lifestyle strategies you could ever use. And then get yourself on the sweeties and the Beyond Tangy Tangerine, which is part of the Healthy Start Pack. The good news is, well, the bad news is, if you don't work at this triangle, there's no way any of your other diseases or any of your other symptoms will resolve themselves on their own, and there's no drugs that can do it. And doctors will say, there's nothing we can do. There's no, you can't say the C word, the cure word. There's no cure for your psoriasis. There's no cure for your Parkinson's. There's no cure for your Alzheimer's or your heart disease, but it doesn't matter because cure is magic. We're not talking magic, we're talking science. We're not talking cure, we're talking reversal. And while there's no cure for any of these illnesses, they are all reversible. But you got to start off with the triangle of disease because that's what underlies everything else. Does that make sense, you guys? All right. So I want this to be inspiring. I want this to be the kind of message that you go out and tell people and they feel better just by hearing it, let alone once they start to incorporate some of these concepts and some of these products into their lifestyle, just by hearing this message. If you guys are a healthy bunch here, but can you imagine how hearing this kind of message can be inspiring to people? And that's the business we're in. We're in the business of hope. We're in the business of inspiration. We're in the business of giving people a sense that they can do something about their lives. And the way I look at it, there's no more important work that a human being can possibly do than to give your fellow man hope and inspiration, fellow man and woman. Thank you guys very much. That was great. Okay, so I'm happy to take questions as long as it's before 3:30.
I was
Do you have
gonna
any
say, you have a plane you have to catch.
I have a plane. Are there any questions?
So, the Hewlett team wants to say
Oh,
hello
hi,
to you
Jill.
from all your fans in Canada.
Okay.
So yes, Jill says hi.
Hi, Jill.
And, yes, John, this lecture will be made available that you can watch later. You'll want to check out Critical Health News, YouTube channel. So anybody here have any questions? I have it set up so that they can hear the questions now in the room.
Yes, Mr. Ray.
So what would you recommend on the first, someone on the digestive system? What would be?
First thing is, well, that's good. Let's talk about that. We talked about the food diary, and then following that, the elimination diet. So let's talk about a few supplements that are important for the digestive system. Of course, the most important is going to be soil bacteria, the bacteria that live in the soil, i.e. the probiotics, right? I love the nightly essence. Since I'm kind of old school, I've been doing this with longevity for a lot of years. So there have been some new formulations that have come out. One is called the Daily Digest, which is really nice. And then I just had some of this pre and postbiotic, which is also nice. That's the first thing. Okay, the probiotics, the bacteria. However, there's also things that you can use to support the growth of those bacteria, and that's the prebiotics. That's what this has in it. And you said FOS, I think, right?
Yes, inulin.
Inulin, FOS.
Yeah.
One of the cool things about prebiotics feed probiotics, okay? Prebiotics feed probiotics. One of the cool things about prebiotics is they're naturally sweet. So you'll find them in a lot of supplements, and they have a nice sweet flavor to them, nice sweet taste to them. Inulin is one, FOS, fructooligosaccharides is another. Fiber in general is, and all of these things that we're talking about, these prebiotics are fiber-based, either soluble fiber or insoluble fiber. And I didn't talk too much about fiber, but fiber is really interesting because it doesn't really do anything. It's inert, but bacteria love it. And so bacteria can eat the fiber and not only thrive and proliferate, but they can secrete something called postbiotics. This is a term that you're going to start to hear more about. It's only been in the vernacular probably for a year or so. Postbiotic is something that is secreted out of a probiotic in response to a prebiotic. You guys get this? Prebiotics feed, probiotics with bacteria, postbiotics with secretions. These bacteria secrete wonderful, healthy compounds, the most important of which is butyrate. And butyrate is secreted in response to fiber, which is one of the reasons why people who have high fiber diets tend to have healthier colons. Fiber is also important for women who are dealing with estrogen problems that show up as fibromyalgia, menstrual issues, infertility issues, breast cancer or fibroids or cysts. All of these, and by the way, the probiotics help the body process estrogen. So for women who are dealing with estrogenic health issues, and there are many estrogenic health issues, not only are probiotics important, but also so is fiber to support the probiotics and also to help eliminate the estrogen. So if you have migraine headaches, if you have fibrocystic breasts, or if you have something called polycystic ovarian syndrome or cysts in your uterus, endometriosis, which is an absolutely miserable health condition, and God forbid, breast cancer, ovarian cancer, uterine cancer. All of these are associated with high amounts of estrogen. Using probiotics and using fiber to help eliminate that estrogen, as well as to support the probiotics, can be a godsend.
The microbiome would be a really good one because it has all of that.
Absolutely. Anything you can do to support the gut,
The ultimate
the
microbiome.
ultimate microbiome, which that's another one of the new products that I forgot to mention. Yes, absolutely. Now, the second thing you want to do for the stomach, this is, and also for the intestine, is enzymes, digestive enzymes. Digestive enzymes are, in pharmacy, as a pharmacist, I'm always looking for multifunctionality. I love supplements that give you multifunctionality. I have this little joke that I tell, so you guys can laugh, make me feel good about myself here. I always say, nutrients are what drugs dream they could be, right? A nutrient, when prednisone goes to bed at night, it dreams it was vitamin C. Why is that? It sounds funny, but it's not really funny. It's serious because drug companies spend billions, trillions of dollars looking for poisons, pharmaceuticals that will have an effect with no toxicity. And when they do find this, they're just happy to find something that has one effect and no toxicity. Well, guess what? We already have those. They're called nutrition. They're called nutrients. They're called vitamins. They're called minerals. They're called essential fatty acids. They have zero toxicity. And not only do they have one benefit, they've got multiple benefits for the entire body. So when a drug goes to bed at night, it wishes it was a vitamin. It wishes it was a mineral. It wishes it was an essential amino acid or an essential fatty acid. So when you talk about nutrition, when I talk about nutrition as a pharmacist, I'm always looking for multifunctionality. So just to give you one little example, glucosamine, right? Glucogel caps. What do you take glucogel caps for? Bone joints, right? Bone joints. But do you know the glucogel caps will help you build strong blood vessels too? Do you know the glucogel caps will keep you from getting wrinkles? Do you know the glucogel caps will help you prevent ruptures and hernias? Do you know the glucogel caps will help thin your blood? If you've got thick, sticky, sludgy blood, and I didn't tell you about dirty blood, which is pretty much the missing link between all triangle of disease and chronic degenerative diseases. The middle point is dirty, sticky, sludgy blood.
Blood gets dirty
Because of the gut and the blood sugar and the cortisol, all that. That's correct. But my point is the glucogel caps are a blood thinner. They'll help thin your blood so you get more oxygen, more nutrients to your blood. How do you like that? And it's non-toxic. Imagine a drug company came out, we got this new drug. It's great for ruptures and hernias and blood vessels. It's great for thinning your blood. It's great for arthritis. It'll keep you from getting wrinkles. It'll help you regenerate tissue post-surgery, and there's no toxicity. You think you'd want to invest in that drug company? Heck yeah, but we already have that with the glucogel caps. Another one of my favorite multifunctional nutrients is digestive enzymes, the ultimate enzymes. Now, we all know about the ultimate enzymes for digestion, but the ultimate enzymes are great for post-surgical wounding to help accelerate healing, not even post-surgical if you fall down and you have a bruise. Using ultimate enzymes can help break up that bruise and accelerate healing. The ultimate enzymes are a wonderful blood thinner. The ultimate enzymes can be used for back pain, for dental pain, for headache pain. This is one supplement that's marketed for digestion. And of course, it's going to help you with your digestion because the body depends on enzymes to break down foods, especially hard to break down foods like proteins. In fact, under conditions of enzyme deficiency, proteins don't get broken down as effectively as they should, and little pieces of protein, little pieces of hamburger, little pieces of soy, little pieces of milk or cheese or dairy will actually make it into your bloodstream and wreak havoc on the blood immune system. And this is a major cause of autoimmune diseases. In fact, this condition, which is part of what's called leaky gut syndrome, is a major cause of a lot of problems. And something as simple as using digestive enzymes to promote the complete digestion of these foods can go a long way towards relieving inflammatory conditions that are associated with small pieces of protein, they're called peptides, leaking into the bloodstream. So your ultimate enzymes have pain relief properties, they have digestion improving properties, they have anti-inflammatory properties, they have blood thinning properties, and because the secretion of bile depends on activation or acidification of foods at the level of the digestion. Noni or apple cider vinegar or aloe vera. any of the probiotic products that we have, the Ultimate Microbiome, I like the Nightly Essence. By the way, the Nightly Essence, the reason I like it so much is because it has enzymes with it. So it's one supplement that has both a whole bunch of bacteria, in fact, 15 different strains of bacteria, plus it has your digestive enzymes with it as well. So those are all great strategies. And two more non-nutritional strategies for working with the digestive system. One is to chew. Really chew. Really, you know how they used to chew? I don't know if you ever heard this, 50 times. Try it. It's almost impossible, right? There are food companies like Boston Chicken and McDonald's. They will inject their animals or inject their food with softeners so that you have what's called throat slip. So the food goes down your gullet really fast, right? So you'll eat more. The more you chew, the less you'll eat. And then what's the most important digestive organ?
Gallbladder.
No, the gallbladder is really important. No,
Pancreas.
no, that's important. No, the brain.
The brain.
Think about your food. In fact, if you sit here and think right now about a food that you like, what's going to happen? You'll start to salivate, right? So pay attention to your food. Not only that, but when you're thinking about your food, when you're activating your digestive system, you'll find that you're eating less food when you're actually paying attention to your food. And if you want to do something as a bonus, pay attention to your food with gratitude, and you'll activate your parasympathetic nervous system, and you'll be digesting more effectively. That's why people say grace before they eat meals. When they say a prayer, it activates the parasympathetic nervous system, which is a whole nother juicy story that we'll talk about on my next visit, is the parasympathetic and the sympathetic nervous system. Okay, so that answer your question?
Yeah.
Okay, yes, ma'am.
When you're talking about fasting to start off, how long do you fast? How long do you recommend fasting?
How long do you fast
How
for?
do you know when to stop?
Well, Jesus did it for 40 days.
Right?
So that might be a good place to start. No, I'm just kidding. It doesn't really matter as long as you can. As long as you can. But the thing is, once you start into ketogenesis and your body's secreting all of these chemicals, these feel-good chemicals, you're not going to want to eat. In fact, you're going to have it really is hard. Have you ever experienced this where it's really hard to eat after you fast? It's like you don't want to eat. And so just go with it as long as you can. There's really no answer to that. Now, you're not going to pass out. People are always afraid, am I going to pass out? Is it going to be, am I going to have enough energy to function? Well, you'll actually have more energy after you reach a certain point, but you'll have to see where that is for yourself. Fasting can be just between meals. That's one of the cool things about the body is the body starts to heal itself between assaults. Do you know your lungs start to heal between cigarettes? Your digestive system starts to heal itself between meals. So whatever you're doing, if you give it a break, you give your body a break, a space, however that is, it could be 2 hours, it could be 20 hours, it could be 200 hours, whatever it is, it's going to be in your interest and you'll have to see for yourself.
Personally, what's your favorite food to break a fast with? Your personal favorite?
Bananas.
Bananas, okay. And then would they be really ripe or? do you
No, I don't like my bananas really ripe, but you don't want a lot of sugar.
Got it. And then do you?
Yogurt too.
personally
Yogurt's
yogurt, like not a dairy, not like a goat or a.
I do dairy yogurt, but yeah, coconut yogurt.
And then do you recommend enemas while fasting?
Say again?
Enemas while fasting.
Enemas are all right. They're colonics. You really want more than an enema. Enema just gets the first part of the colon, but a colonic, you guys know what a colonic is? They squirt water up you and you clean everything out. They're amazing. They're really amazing. For anybody who's dealing with estrogen issues, because estrogen is eliminated from the bowels. And by the way, one of the things that happens when your thyroid is suppressed with this triangle of disease is constipation. And also, I didn't tell you this, but the thyroid regulates the digestive system. So when you're hypothyroid, your digestion suffers, and then you go through this triangle all over again. All right, so it's like a vicious downward spiral. Constipation is always associated with hypothyroidism, unless you have some kind of mechanical issue. You could have a mechanical trauma. Yeah, if you have something mechanical, that's one thing. But the thyroid regulates the digestive system. So this triangle of disease will take care of constipation. Estrogen is eliminated through the bowels. So for women will notice if they have estrogen issues. How many of you ladies have been told you have an estrogen issue? If you haven't been told, you probably still have one anyway.
Low.
What's that?
Low.
Low, but here's the thing about estrogen. You're always making estrogen because it's always made in body fat. But estrogen, if it's not broken down effectively, it can build up into something called toxic estrogen, technically catechol estrogens. And these are the estrogens that are responsible for a lot of the health challenges people have in association with estrogen. So helping your body clear it out, all the anti-constipation things, fiber, magnesium, vitamin C, probiotics, all the things we talked about are very important for dealing with this estrogen issue. Also, estrogen is broken down in the liver. So you got to make sure that you're firing on all cylinders with the liver, and your ultimate EFAs are great for all of that. Yes.
And then we have a question in regards to fasting. Do you recommend just intaking water? You
Mhm.
mentioned taking your
You can take your supplements. though.
micro supplements.
Yes, absolutely.
Nutrients.
Because calories are what you're trying to avoid. Is the calories. Yes, the Beyond Tangy Tangerine. And let me just say this about Beyond Tangy Tangerine. You'll hear people say sometimes it's too sweet. It doesn't taste good. Start off slow. Do a small amount to where you like the taste. You don't need a full scoop or a full 2 scoops. Some people like a full scoop or a full 2 scoops. I talked to a lot of people who like that much. Do small amounts if you don't like the taste. Don't deprive yourself of these incredible nutrients. And then also sometimes people say that when they do the Beyond Tangy Tangerine, their stomach doesn't feel so good. They feel a little bloated. Anybody hear this? They feel a little digestive discomfort. Smaller doses, and let your body get used to that kind of nutrition over time. And so the dose is, if people don't like the taste, it's dose dependent. If people have digestive issues, it's dose dependent. It's much better to do it in a small amount than it is to not do it at all. If people have an issue with the taste or with
The
digestive.
pills are just as effective as the powder, right?
No, because the liquid is really what the advantage. It's a major advantage that you don't get with the pill.
Oh, okay.
With the liquid, the body can use it more effectively and it can get absorbed more effectively. If you're just doing the pill, you've got to go through the whole digestive process to crush it down. You'll still get benefit, but once it's liquefied, liquids are the preferred way to absorb nutrients in a liquid form. That's one of the reasons why I didn't talk about vegetable juices, but vegetable juices are also really important. Okay, you guys are awesome. Thank you so much. Thanks for listening. Thanks for the support and love. And thank you, Becca, for putting this on. That was awesome. And thank you, Melissa. These are your hostesses here, hostesses.
Who learned something today?
Oh, yeah.
Always.
Awesome.
All right, and for all of you that are on with us, I hope you learned something also. So taking this message, would you hear this anywhere else?
Nope.
No.
Would you hear it from mainstream medical?
No.
That's why we are in such great need. We have the ability to make an impact and have purpose, and that purpose is to build healthier communities, healthier families, healthier communities, healthier world. So I invite you, if you are not already involved as a distributor with Longevity, get with the person that invited you to watch this program and ask them about how you can get a thank you check for sharing this information with others. Because when they take the supplements, they feel the difference. I tried so many different programs before finding Longevity that promised me that I would feel the difference. Well, those promises all didn't come true. With Longevity, I didn't get that promise, but you know what? I got the results. I lost 100 pounds just taking supplementation. I got energy. I had a better mindset, love life. I'm not laying in bed anymore or having to have somebody roll me over before they leave for work so I can get out of bed, because it was pretty rough. And there's a lot of people out there that can relate to this, and they're waiting to hear this message, and they're only going to hear it from you because you've heard it, and now you are empowered with this information to go out and share with others. So I invite you to share that information from the heart, because when you do things from the heart, that's when it's received. And I am so blessed for this opportunity because I've been able to make an income off of it. We don't guarantee any income, but when you put your heart into it and share from the heart, it is very possible to make this a thriving business. So Melissa,
Yay. Hey, guys, we're gonna cut off really quick.
We
We're gonna
gotta
have a
cut
party
off.
without you right
So,
here.
bye everybody. We love you, and wait, because we are going to be having more events and we will be doing more live streaming. And if you want an event in your area, please contact me, Becca@BeccaFuchs.com.
Thanks,
Bye now.
Becca.